Graded exposure therapy for chronic pain. This video is to be viewed in conjunction with the other educational videos on thepaintruth.org. If someone wishes to learn to swim, could they learn to swim just by reading a book? What if it was an amazingly detailed book written by an incredible swimmer? They probably wouldn't learn to swim just by reading. What if someone wishes to learn to swim? Could they learn to swim just by watching a lot of swimming videos? What if the instructor in the videos is a world championship swimmer? Still, one needs more than videos to learn to swim. Because the only way one can learn to swim is to actually get into the water. Welcome to this presentation on graded exposure therapy, which is all about getting into the water by first getting your feet wet. The truth is that if you're experiencing disabling persistent pain and wish to get back into doing your desired life activities, no amount of reading, videos, internet searches, or passive treatments will work until you actually take action. Let's dip in and get started. What is graded exposure therapy? Graded exposure is a way of desensitizing the nervous system with the aim of reducing the fear that is experienced with specific postures, movements, or activities. When pain system hypersensitivity exists, fear always fuels pain. And the opposite is also true. Fear reduction leads to pain reduction, as can be seen in the fear-pain cycle. Because when fear is reduced, pain is reduced. Some deny having any fear, yet they experience significant pain. So how can that be? The truth is that most of our fears aren't conscious, but are experienced by our subconscious mind. If someone in pain says, "But honestly, I have no fear," then simply ask them, when you experience pain, does your nervous system feel more safe or feels it's in more danger? The answer is always in more danger, because that's the whole purpose of pain, to warn us of potential threats. Therefore, instead of focusing on eliminating pain, our focus in the Pain Truth program is to gradually reduce or eliminate fear, because fear is always the fuel for pain. Which one is being added to your flame? A sense of safety or fear? Just appreciate that it is impossible to experience pain once the nervous system feels safe. So, how does one get out of the fear-pain cycle and feel safe again? Graded exposure therapy helps those experiencing chronic pain to break out of the fear-pain cycle by facing their fears of certain postures, movements, or activities in a gradual, non-threatening, and safe way. So what's the basis behind graded exposure? Anyone living with persistent pain naturally wants to avoid making their pain worse. So instinctively, the assumption is that by resting and by avoiding painful situations, they may be helping their body heal, when in fact, the opposite is true. The more we avoid specific activities, the more sensitive we become to them, and the more we needlessly limit our lives, because avoidance magnifies fear and magnifies pain. Avoidance can lead to loss of muscle strength, loss of mobility, loss of self-confidence, loss of function and ability to do daily life activities, loss of hope, loss of social connections, and sometimes depression and anxiety. But there's hope. There's an antidote to avoidance. We call those adopting a baby and taking baby steps, or graded exposure. The aim of this approach is to break the associations that the brain has made between fear, pain, and specific activity by introducing the painful activity slowly. Graded exposure therapy involves teaching the brain that it doesn't need to create pain in reaction to specific situations and movements. However, this process takes time and patience. Graded exposure is certainly not a quick fix in any way. With this slow and calm approach, the brain is given positive feedback that a particular movement doesn't need to be feared and doesn't need to cause pain. The scientific fact is that gradual exposure to a desired activity works. As the activity is gradually built up to being performed more intensely, you gain confidence, and in time, the brain learns that it can do the activity without fear or pain. Of course, we all have a limit, but fear limits us way below our actual threshold and our potential. Let's first hypothetically talk about snakes. Imagine if someone was afraid of snakes. I mean, really afraid. I mean, they couldn't even see a picture of a snake without emotionally reacting to it with fear and anxiety. A person who has a fear of snakes or anything, when exposed to what they fear, they will experience one of the three F's, the fight, flight, and freeze response, which are 100% real. So, how does one reduce or eliminate their fear of snakes? First of all, the person must first want to eliminate their fear of snakes. If their fear of snakes has little or no impact on their quality of life, then there's little motivation to actually want to change. And that makes perfect sense. However, if their fear of snakes interferes with their quality of life, then the motivation would be there to want to change. For instance, what if they avoided leaving the house with the fear of possibly interacting with a snake? Therefore, they couldn't just easily go grocery shopping, go to their yoga class, out for coffee with a friend, go to work, or to walk in the park, or to a movie theater, or whatever. Instead of choosing to fear and just avoid snakes forever, in order to live their normal life, a viable solution would be to voluntarily, intentionally, and gradually expose themselves to snakes. Of course, I mean the non-venomous and the non-dangerous kinds. If someone wishes to try graded exposure for their fear of snakes, then the exposure to snakes must be done in tiny steps, be done voluntarily, and feel non-threatening. In other words, the steps must feel safe. There are two basic types of graded exposures: imagined exposure and real life exposure. Imagined exposure is basically to do it calmly and playfully. Imagine seeing. In the instance of a snake, you see a small snake far away in the distance. Then perhaps a larger snake close up. And now you could visualize a snake by your foot, or perhaps even visualize safely touching a small snake. After imagined exposure is real life exposure, and this is level 1, where you look at a picture of a snake, touch a picture of a snake, watch a video of a snake for a few seconds, see a video of someone touching a snake. Real life exposure, level 2. You look at a plastic snake up close. You touch a plastic snake. You hold a plastic snake. You draw a snake. Real life exposure level 3. You look at a real snake behind a glass in a zoo, perhaps. Look at a real snake without a separation wall, as in a petting zoo. And finally, real life exposure level 4. Touch a snake or hold a snake. Again, the non-venomous and the not dangerous kinds, of course. So, what do snakes have to do with pain? Desensitizing someone's fear of snakes can be similar to desensitizing a pain experience that is directly associated with a posture, a specific movement, or an activity. Choosing the right activity is important. So what posture, movement, or activity do you wish to get better at experiencing? Here are the 6 rules for choosing the optimal activity that's right for you. Number 1, it must be a movement or an activity that produces discomfort, either consistently or inconsistently. Number 2, it must be a movement or an activity that you truly desire to do with confidence again. That could be as simple as being able to sit and work on your computer or watch TV. Number 3, the activity must be modifiable so that it can eventually be done with no fear. But modifiable mean you can reduce the time, reduce the intensity, change the environment that it's done in. Number 4, you must be willing to start with a very low dose of the activity. The lowest dose is usually just imagining the activity while just laying and calmly breathing and feeling safe. Number 5, accept that the activity you have chosen does not pose a threat to your well-being, such as bending and lifting, twisting, lifting arms overhead, turning neck, or running. Number 6, accept that the fear and pain that consistently result from exposure to the particular activity are at least partially due to a pain system hypersensitivity. Let's now talk about graded exposure therapy guidelines. 1. You must decide that it doesn't matter if you develop pain or anxiety during the graded exposure exercises. It only matters that you're not afraid of developing the pain or anxiety. Number 2, if pain and anxiety occur, you will choose to observe them with detachment, curiosity, and interest, rather than reacting to them with fear, worry, and frustration. Don't be upset that they have occurred. In fact, you want pain and anxiety to occur, because then you have the opportunity to intentionally respond without any fear. With repetition, this will train your brain that these sensations are not dangerous at all. Number 3, repeat the activity, imagined or performed, until you can do it without evoking any unwanted physical or emotional sensations. 4, imagine and do the activity with joy and ease to imprint that connection into your brain. You can walk just a few steps, sit for only a few seconds, or slightly bend forward, do squats with weights, and do your unique desired activity with joy and ease. 5, remind your brain as you engage in this activity that you're perfectly fine, you're not in danger, and that this activity won't harm you at all. A graded exposure therapy motto is, let's get comfortable with being uncomfortable. So let's continue with the graded exposure therapy guidelines. Number 6, always appreciate that as long as you engage in your desired activity without fear, you're making progress. Even if you should experience pain or anxiety, it doesn't matter. Rest, take a break, modify, and calmly repeat the activity again. Number 7, accept the fact that there will inevitably be times when the activity will be more difficult, and there will also be times when it will be easier. Listen to your body and be kind to yourself. And finally, number 8, gradually, or sometimes quickly, you'll find that you can experience the posture, movement, or activity with less or even without any discomfort. You are reprogramming your brain. Even when the pain is there, it won't bother you or limit you as much. Graded exposure therapy can be summarized in this image, where on the left-hand side, the before picture, the latter steps are far apart from each other, where it can be difficult to even begin to take the first step. However, with your knowledge of graded exposure, the latter steps are close to each other, and taking one small step at a time becomes easier to climb the ladder. Graded exposure therapy tackles the least fearful situation first. You must make your way gradually up the hierarchy in a step-by-step fashion. This allows the brain to adjust to not needing to react in fear or send out pain signals for these relatively easy activities. Therefore, imagined exposure is often a safe place to start. Graded exposure therapy helps teach your mind that the activities you have been avoiding no longer need to cause fear. By reducing or eliminating the fear associated with an activity, pain may also be reduced or eliminated. Instead of avoiding situations, it's time that you face them head on and with confidence. So go ahead, take the first small step. Remember, whether it's learning to swim or anything else, whatever your desired activity may be, no amount of reading, videos, internet searches, or passive treatments will be effective until you actually take action. Dip your feet in the water and feel safe while doing it. Until you can eventually get fully into the pool, and who knows, perhaps to even swim. Here's an important note. While no treatment offers guarantees, graded exposure therapy empowers you to reclaim as much of your life as possible, not by eliminating pain, but by moving forward with it. Your Pain Truth Certified or PTC healthcare provider will guide you through the safe application of graded exposure therapy. Thank you.